Urinary incontinence is what it sounds like. It's the involuntary loss of urine. It's a very common condition. There are many different types, but the two most common types are stress incontinence, and this refers to physical stress like coughing, sneezing, dancing, lifting, and the patient ends up having an accident. The other main type is called urgency incontinence. It's when you hold your urine, you get your keys in the door, you're ready, and you can't make it to the bathroom before you can disrobe, you have incontinence. So those two types are the most common. There are various others, but really 90% of the time it's going to be one of those. Stress incontinence occurs because of a loss of support under the urethra, which is the tube that comes out of your bladder. And there are various risk factors for this: obesity, pregnancy, vaginal delivery, chronic constipation, things that cause the body to put pressure on the pelvis, and it results in a tear or a stretching of the support under the urethra. On the other side, you have urgency incontinence. This can be a symptom of a syndrome called overactive bladder syndrome, which includes going to the bathroom frequently, getting up at night too many times, and not making it in time to the bathroom. The reason why this happened is less well understood, but we do understand that the muscle of the bladder can sometimes become so thick that you don't have a large bladder capacity anymore, and when the bladder contracts, you have difficulty holding. What is important is if it's affecting your quality of life. If you're having to wear pads that are costly, after a while the cost adds up. There are ways that we can stop urinary incontinence. So my answer to that is it varies per patient, but we see people who have 1 drop to 5 pads a day. It doesn't matter. We'll sit down, we'll educate you, and you'll make the decision that's appropriate for you. Since the problem is with the support of the urethra, there are devices. Women are very comfortable with tampons, using tampons for their menses. There are a variation of a tampon that can be inserted to support the urethra, which is the exit of the bladder. That's one example. There are bulking injections. So in the same way in cosmetic that people put collagen to bulk their lips, there are bulking injections that can be placed to tighten the urethra. Pelvic physical therapy is a big part of what we do as well, so strengthening the muscle at the entrance of the vagina. On the surgical aspect, we do what's called supportive procedures of the urethra. This can be done most commonly nowadays with a suburethral under the urethra sling procedure, which is a synthetic material that is placed. It's an outpatient procedure. It takes about 25 minutes, and it's the success rate are 90th percentile. On the urgency side, the first line is lifestyle and behavior modification. When I talk to my patient, it's amazing how us in the American culture have changed our consumption of bladder irritants like caffeine, so coffee, tea, and soda. It may not irritate your bladder in your 20s, but as we go further into life, women lose estrogen and the tissues get thinner, and these substances become very, very irritating. So that produces that urgency sensation that you have difficulty deferring the need to urinate. So we spend a lot of time educating people about things to avoid, and sometimes that's all they need. When that doesn't work, then physical therapy and medication can be helpful in relaxing the muscle of the bladder. In the US right now, we have about 7 different medications that help people with urgency incontinence and overactive bladder.